I'm going to perform scapular depression to activate lower trapezius and lower serratus anterior muscles fiber to improve dynamic strength of glenohumeral joint. Let's get started with video. Patient will be in sitting position and then I will apply upward resistance and patient have to move his arm downward direction. 1, 2, 3, 4, 5. Relax. Again. 1, 2, 3, 4, 5. We have to perform this exercise for 5 times to get better results, as well as during this movement a caudal or inferior glide will also happen at glenohumeral joint. An alternate exercise for scapular depression, that is upright press up. Patient will be sitting and place both hands on the blocks. Elbow will be extended and then patient have to push down on the hands and lift the body. This exercise will emphasis on scapular depression and activate lower trapezius and lower serratus anterior muscles.